Okay, so we ended our last video on the objective tab. Again, you can click on lumbar and go through the different active ranges of motion and document what you did. I also alluded to the fact that we have incorporated DAX Copilot into our documentation system. And so I will show you that in this video. I will also show how I personally take my objective measures using different smart phrases. So there's three places where I put in what are known as DAX Copilot Smart Sections. I think it's maybe easiest to show these on the side pane. So at the top, I put in .ap section. These are known as smart sections. That's what the SEC stands for. AP stands for assessment and plan. I click on that, and so this you'll notice the symbolization here, which is an indication that this is going to be audio recorded from the visit and what the patient tells us. The second thing that I put in is under the subjective tab, and I put in .hpi sec, and this will put in the information that is recorded that is relevant to the subjective. You have the option to also do it for your objective tabs, where you do two things: PE, as in physical exam, SEC, and then results, SEC. Actually, it's result, SEC. If you so choose to use the DAX, then you also want to put in DAX consent at the bottom, which just states that you've informed the patient that the audio recording tools aided in the generation of this note. And it's simply just a disclaimer letting you know that they are informed. At the current time, you don't need to get their consent necessarily, but you do need to inform them of that case that is being recorded. The second thing beyond just the implementation of the smart sections, which we will go over in more detail about DAX Copilot, is putting in the smart phrase that I mentioned. Smart dot phrases, also known as what they're called, that term is utilized interchangeably. Dot phrases and smart phrases, this is where I document my objective information. So all of them start with my initials, .mj. It's an evaluation note, so I type in eval. It's in the plan section, so I type in plan. And then I type in the body region in question. In this case, sticking with our theme of lumbar spine, you can see that I have an archived version of lumbar spine 2. This one is obviously starred, and that's the one that I utilize. Okay, so what just populated, if I hit F3, which expands this, so I call them my key functional indicators. These are the things that I track for all lumbar spine patients. It's organized in a pain, sensitivity, mobility, motor coordination, strength and muscle performance, and then any additional functional tests that may come within that. So you can think of this as essentially my funnel, if you will, which is touted by Dr. Michael Rainman at Duke University within their DPT curriculum. So I don't use all these with every patient, let me just be clear, but these are all the potential things that I could measure within the lumbar spine patient. So pain sensitivity, so pain pressure thresholds, for instance, would be an example of that. And you can do this on the upper trap, cervical segment, and or tibialis anterior to look at get a sense of their central sensitization or central neuroplastic pain, which is prevalent in spinal pain patients, particularly in the chronicity conditions. And then lumbar spine. So for instance, usually what I will do is I'll put in .tdn, as in today's date, and then the N means non-refreshable, as you can see it populate there, and then it populates today's date. And I would put in, you can see that I use inches, fingertips to floor, so maybe that's 23 inches. Extension percent of normal, they're at 75%, so on and so forth. If I hit control and then also the open bracket, it can add additional rows to that table so that I can track it over time. And I would, for anything that I do measure on that day, I would put it into these tables. But you're certainly welcome to use your own uh, form of documentation, be it utilizing these smart phrases for the different body regions or using the objective tab. The documentation in regards to DEX Copilot, I will give you further clarification on what that would all entail. But that's somewhat a separate entity compared to what we're going through with just our standardized workflow for the evaluation at the moment. Okay, so I think that takes care of all the major elements of your evaluation note: the assessment and plan, the goals, the subjective, the objective, and then you can see how the note is laid out here. Okay. The other thing beyond just the place to put your objective that populates with that that dot phrase that I incorporated is the interventions. So I would type all interventions out that I did. Maybe we did, I don't know, McGill planking progression. We did we did cat camel, and then we did thoracic rotation. So I would type out my interventions under that visit 1. And then this is just a pre-automated progression of sequence of different interventions to jog my memory of what I may want to do in the future based off how I treat the lumbar spine in this case. Certainly we'll need to adapt this over time depending on how the patient presents and what their diagnosis is. Additionally, what I will do is I'll do .tdv. This is usually for the next visit, for instance. I wouldn't do it on this note per se. In fact, I definitely wouldn't. TDV would populate the next, like if I saw them next week, for instance, it populates the week of the current date, as in today's date, and then it gives me an open text field for where I could populate the next visit information. Okay, in closing out the note, what we'll need to do is we'll need to copy this. I spoke about in previous videos that we're kind of moving across our tabs sequentially. The next tab is going to be treatments. I will often just copy and paste these treatments into there. Maybe we did manual, and if we expand this or move it over, so you can see that therapeutic exercise, manual therapy, gait, and so any intervention that you did, for instance, maybe the cat camel and the thoracic rotation, was you deemed that to be more therapeutic exercise, but when there was a lot more motor learning going on and teaching with the McGill planking progression, so you put that there, and it's probably good practice that we did 5 times 30 seconds in side plank, front plank, etc. Right, whatever you want to put in there. So you can get as specific as you so choose. I'm usually pretty brief here, as I've already documented it elsewhere, and so I'm going to hit accept, and the treatments are in. So we've taken care of the treatment tab. Next is your wrap up. So this there's several sections here. So you have your PT charges, you have your charge capture, and then at the bottom you're going to have your sending off your plan of care. So let's go through each in turn. So we're going to say we're going to do a new charge. So it was 30 minutes evaluation. We did 12 minutes of therapeutic exercise, and then we also did the neuro re-ed, and that took us 16 minutes. I can hit the down arrow, or you can see how it says hit F8 to go to next section. I'll just click the down arrow. What automatically happens is that this will populate the PT charges as predicted. So if they have private insurance, then it will kind of go through the sports medicine private pay. and these will pre-populate. If they have Medi-Cal, these won't pre-populate, and you'll need to put in initial evaluation 30 minutes and then initial combined 30 minutes, which is in the Medi-Cal billing system. They don't specify the different types of CPT codes. They just kind of lump them all together. But for us, we're going to put in our essentially, we're going to do our initial evaluation, and then we're also going to put in our neuromuscular re-ed. Okay. And you can see what is populated below has been our different charges. Okay. For some reason, the evaluation 30 minutes didn't actually take. It just took. Seems like it just took 30 minutes, but so be it. Usually that will also populate. So you would have your 2 codes for your treatments, and then you would also have your initial eval. In this case, it was a 30-minute eval. So I think it's just because this is a test patient, that's why it didn't work out. But you would have 3 codes here. You have your eval complexity code, you have your therapeutic exercise, and your neuromuscular re-ed. The next thing that you're going to need to do is, so let's just clarify because that's a little bit confusing. So first section, you just put in the time of each, the time that you did each of your PT your PT CPT codes, right? So evaluation. Next is your interventions. What interventions did you did? How long did you do them for? If you did any modalities, you'd put them in there, and then you could either click this arrow, or you could click next, or you could hit F8. That would take you to your next section. You can see that this is red because the service date is in the future compared to when I'm currently doing this. But typically, you're not going to be billing ahead of time, ahead of time. So this should say the date that you're of the encounter, and that would be also the same date as you're filling this out, and that wouldn't be red. And then, so you have your 3 codes here. So as soon as you click on them up here, they populate automatically in the accepted charges. Next, you need to send off the plan of care. So you're going to click the 3 dots. You're going to hit internal provider. You're going to hit accept. We only are really taking internal providers. That internal provider means that the referral came from someone within the Stanford community. You hit accept, and then you're going to need to sign this order. So when I click on sign order, I'm going to need to look over here. Right now, there's no referring physician, as I alluded to. There's no referral in the test patient's chart, such that it doesn't populate. But this should, right under PCP, it will have your referring provider. You would type that in. In this case, we would type in, we'd type in like Seth Sherman, which is one of our physicians. You click on his name, and then this would populate, and you could hit accept, and that would send it off. I'm not going to do that just to not blow up his inbox. And then you would, once that's all said and done, you would sign that, and you'd be good to go. So I'm just going to delete the order for now so that we can show you what happens. Remove. All right, and then you can sign and counter. So you're going to need to, when we go back to your notes, so this is still, your note is still open. So if I actually click sign and counter, I think I'm going to get an error message. Yeah, because I need to sign the plan of care, and my note has now been signed as well. But if I needed to make an edit or addendum, I could do so. And then, so in order to close it, I would need to send off the plan of care, but otherwise I'd sign and counter, and then the encounter would be closed, and I'd be done with my evaluation note.